It seems that we had a chat malfunction. I don't normally do this, but I sure do like it when everybody else does. If you will tell me in one word in the chat, just so we can make sure that that's working properly, your mood. Give me the mood that you're feeling today, a one word response. You have about 30 seconds. We'll make sure that functions properly and we'll go ahead and get started. I like this. We got some positive moods in the chat. Some tired, which I think is reasonable. Great, content, some good feedback here. Okay, well, it's 1 o'clock and I don't want to keep anyone longer than necessary. I'm happy you're joining us today and wish you a good afternoon. My name is Davelyn Patrick and I work here at Families Helping Families of Southwest Louisiana. I want to welcome you to the Medicare for People with Disabilities webinar today. Before we get started, I want to give my coworker, Miss Melinda Elliott, an opportunity to tell us about a very important program here at Families Helping Families.
Hi, thanks, Davelyn. My name is Melinda Elliott. I am the LaCan team leader in Region 5, Southwest Louisiana. LaCan stands for the Louisiana Council's Advocacy Network. It is a program of the Louisiana Developmental Disabilities Council. We're a statewide grassroots organization or network where people with disabilities, parents, people that care about people with disabilities, professionals that want to make a positive change in the lives of people with disabilities. A lot of times we're advocating for systems that support everyone to live every place, whether they have a disability or not. For people with disabilities to live in their own homes, to be participating members of their schools and their communities. We are actually working on the legislative agenda for the next legislative session. We've worked on things like more waiver services, more home and community-based waivers. We've worked on restraints and seclusion in the classrooms. We've worked on just recently cameras in the special education classroom if the parents request it. I'm sure there's lots of things we've worked on that I'm not thinking of, but we're trying to decide what we're going to work on this next legislative session right now. If you join, whether you're on my team and in my region or another team in another region, you're going to get information on how policy changes affect you and the people that you care about. We do training on skills to effectively advocate for system change. And the most important thing is linking you to policymakers, whether you want to tell your story at roundtables or at meetings with individual legislators, or a few people even go to Baton Rouge, or whether you're just there to support the people that are telling their stories. You can go to the link on this slide when you get your PowerPoint. It's free to join. You're just agreeing to get an email. Once you start getting the emails about issues that are important to you. And if you have any questions, let me know, or I'm giving it back to Davelyn.
Thank you, Miss Melinda. LaCan is very important, and I hope you'll consider joining if you're not already part of it, or even consider being more active if you're not as active as you could be. We're pleased to welcome this afternoon our special guest, Miss Maria Alvarez. She spoke for us last year this time about Social Security, and she's back to speak with us about Medicare. She's a public affairs specialist with the Social Security Administration, and she's going to share with us helpful information today about Medicare. I want to make you aware that this webinar is being recorded. Miss Maria will be answering your questions at the end of her presentation. Everyone's going to stay on mute and we'll take your questions through the chat. So type those up as you think about them. And when she's finished presenting, we'll go ahead and direct those to her and have her answer those for us. For the purposes of sound quality, everyone is muted for today's webinar. Again, I want to let you know that when we finish the webinar, you'll be prompted to complete a post-event survey. And that just kind of allows us to make sure that we're giving you what you need, gives you an opportunity to tell us what else you'd like to hear. But with that, I want to welcome Miss Maria Alvarez. Thank you so much, Miss Maria, for being here. We appreciate you.
Thank you, Dave Lynn. It's a pleasure to be here with you all today. My thanks to Families Helping Families of Southwest Louisiana for inviting me to share program information on Medicare. Although Medicare and Social Security are two different federal agencies, we partner in providing information to the public. And of course, Social Security does have certain responsibilities with signing folks up and basic maintenance of Medicare records. So with that being said, let's see. Dave Lynn, I think I'm getting a message, host disabled participant sharing.
I was pretty sure I had fixed that. Try now, I'm sorry.
Okay, all right. That's what we needed, thank you. And so with that being said, let's go ahead and get started. As far as Social Security programs is concerned, like I said, we do basic education for eligibility. And regarding Medicare eligibility, you can become eligible in different forms. When you file for disability benefits, if you are approved, you have Medicare eligibility within 24 months. There are certain other criteria that allows you to get Medicare quicker than that. But most of us are probably more familiar with Medicare at age 65, which comes with retirement, so to speak. But you can become eligible for Medicare through Social Security disability. And another wonderful provision is that you may be able to get Medicare benefits as a dependent, meaning a child or a spouse, if you meet certain criteria regarding end-stage renal disease. So we're going to talk about that a little bit more in a moment, but let's go ahead and talk a little bit about Social Security's two disability programs, which is mainly what we're going to focus Medicare eligibility around. The two Social Security disability programs are Social Security Disability, or SSDI, and Supplemental Security Income, also known as SSI. So with SSDI, dependents of recipients are potentially eligible for not only a check, but also for Medicare coverage. A person that is approved, as I mentioned, for SSDI is eligible for Medicare immediately after 24 months. Sometimes that 24-month period is absorbed depending upon the date at which our agency determines that the individual's onset of disability is, meaning the starting month at which our Social Security disability decision or criteria was met by the individual. It's very likely that an individual is disabled, but they might not meet Social Security's definition of disability, which is that they cannot do any type of work. So a doctor might find that their patient is disabled. VA might find that an individual is disabled, but that doesn't necessarily mean that the individual meets the criteria that Social Security has designated, which is pretty much having to do with the ability to work. I mentioned briefly that there are a couple of conditions where Medicare is immediate if you are approved for Social Security disability, and that's ALS, also known as Lou Gehrig's disease, or end-stage renal disease. In different parts of the country, there might be one or two more. One that I can think of is caused a lot of diagnoses surrounding environmental hazards. Some of those can also be approved for Medicare instantly. So let's talk first about children and end-stage renal disease. I know Families Helping Families deals a lot with children with disabilities. So the general eligibility guidelines are that if the child's parent has earned Social Security credits, they are potentially eligible as the dependent of an insured worker. And as it says here, 6 Social Security credits within the past 3 years. The parent can also be getting or eligible for Social Security, disability, retirement, or Railroad Retirement Board benefits, which would automatically make them eligible for a Medicare benefit, so to speak. So the dependent child could qualify for Medicare based upon the parent's work record. So not only does the child have to qualify based upon a parent's eligibility criteria for Medicare, but also the child has to be dependent on dialysis, meaning that without the dialysis, the child would not survive, or it has to be a situation where even with dialysis, the child is not doing well and therefore a kidney transplant is needed. So that's the end-stage renal disease criteria for Medicare eligibility on a parent's record. Now, keep in mind that spouses with end-stage renal disease may also have potential entitlement for Medicare on their insured spouse's record. In some cases, this might be an ex-spouse, but there are a number of situations there that need to be considered to see if that's a possibility. But great benefit there, because a lot of times people who have been suffering with renal disease have not been able to work and become insured for Medicare. So that's the beauty of the Social Security program. It protects dependents of workers as well. So who's considered a dependent child? Well, it has to be a child that is unmarried and younger than age 22. If they are between age 22 and 26, there is additional criteria that they have to meet. It's kind of lengthy and detailed, so I just want to let you know that that's a possibility. The dependent child can be a biological child, a legally adopted child, a grandchild, or even a step-grandchild in some cases, and a stepchild in other cases. So if this is a situation that a dependent child of yours or someone that you know is dealing with, keep this in mind that there may be entitlement there for Medicare benefits, which is much needed for a lot of services related to end-stage renal disease. So just a little tidbit on SSI, since you don't get Medicare with SSI eligibility, you do get Medicaid eligibility, which is a state benefit for medical services, but SSI does not come with Medicare benefits, and SSI also does not provide benefits for dependents. So for example, even though the disabled person who qualifies for SSI automatically qualifies for Medicaid. Their dependents would not. If it's an adult or parent with SSI, their dependents would not qualify for any benefit on their record. The reason for that is that SSI is a federal needs-based program, so only the actual disabled individual qualifies for the benefits that come along with it. So with Medicare eligibility, normally it comes around the time of retirement or age 65. But as I mentioned earlier, there are some conditions, ALS, kidney failure, the environmental health hazards that I mentioned also comes into play with Medicare eligibility. But generally speaking, if you're not disabled, Medicare eligibility comes at age 65. So this is something that people that want to retire early as 62, have to really look out for, because Medicare, if you're not disabled, does not kick in until age 65. So Medicare is a possibility on a spouse's record. If the individual themselves is not eligible for Medicare, and say that they are close to retirement age, but they don't have their 40 credits. If a spouse does, when the individual is age 65, they are eligible based upon the spouse's record, and they get exactly the same benefit that their spouse would get under Medicare. So it's an excellent provision, one of the many to entitle individuals for Medicare, and whether, like I mentioned a little bit ago, whether it's through disability or through being close to retirement age. So you have to be 65 or older. And once again, you may have potential eligibility on an ex-spouse's record. There's a lot of guidelines there, but just keep that in mind, because you can look into that if that happens to be your situation. So if you're not insured for Medicare, let's say that you have worked and some, but don't have the 40 credits needed, which is 10 years of contributions, and you don't have a spouse on whose record you qualify for Medicare, you can purchase Medicare, but it is costly. Depending upon the number of credits you do have, the more credits you have, even though you may not have 40, you may have to pay a monthly premium of $274, and that's this year. And if you have hardly any or no credits towards Social Security and Medicare, that monthly premium is as high as $500 a month. So just FYI there, you may hear of someone saying that they purchased their Medicare. Well, that's the stipulation tied to it, and it's a pretty hefty premium to have to pay if you didn't qualify for premium free Part A, which is the hospitalization through years of work or through years of your spouse's work. Now, to sign up for the Part A, you also have to sign up for the Part B, and you have to buy the Part A. You have to have both going at the same time. So, you know, you're first eligible for that Medicare at 65, and if you don't sign up timely, you will have a penalty to pay. I'm talking about Medicare, both in the capacity of disability and of retirement, because you can get it two different ways, so to speak there. But the initial enrollment period, if you want to file for Medicare through retirement age, is 3 months prior to your 65th birthday. And we encourage you to do so 3 months before. The longer you wait, the more your first month of eligibility gets pushed back. There is a penalty involved if you fail to sign up 3 months prior or 3 months after your age 65 allotted initial enrollment period. And I'm going to talk about that penalty in a moment. But if you miss that initial enrollment period, you are still able to file the beginning of each year through January 1st through March 31st of each year. So if you miss your initial enrollment period, it's not like you can sign up immediately when you decide to go ahead and say, well, I'll go ahead and sign up for Medicare. I know I'm going to have a penalty, but I really need this benefit. Well, even so, you're not going to be able to get it immediately. You would have to wait until the general enrollment period of each year. As far as the special enrollment period, this is a situation where an individual might want to go ahead and get their Medicare started at 65. They're going to take their Part A, the hospitalization, which is free, and it works along with a group plan that they may have through work. In that situation, Medicare does not require that you take the Part B or the medical services of Medicare, which is the portion that you do pay a premium for. So if you are in a situation where you're still working at age 65, let's say you're waiting for your full retirement age to take your cash benefits, there's a few situations where you shouldn't sign up for Part A because it's free. And like I said, it works along with whatever group plan insurance you have. Prior to your eligibility for Medicare Part A, even though you may have the best group plan in the world through work, it probably only covers a portion of a medical bill if you're hospitalized. It may cover 80, 85%, a little more, a little less, but think about that. You will still have on average about a 20% a bill that would come out of your pocket if you did not already sign up for Part A at age 65, okay? So it's a great benefit to have on board. You don't pay a monthly premium for it. The only reason why you may not want to file for Part A at age 65 is if you have a health savings account through your employer. In certain situations, there are tax implications. So what we recommend is that you talk to your personnel department and discuss with them about your plan to take Medicare Part A and have them tell you how that might work along with a health savings account. I like to go over this information pertaining to not only disability entitlement for Medicare, but Medicare entitlement at age 65, because it's very likely that someone reaching that age has dependents that could also partake in the Medicare eligibility portion of Medicare eligibility. So let's talk a little bit more in depth about the two parts of Medicare Part A and Part B. Whether you get Medicare because of a disability or because of being 65 or older, the plans work the same. Under disability, you get the same benefits as you would under age 65 Medicare. So the Part A, we've already established, is free. You don't pay for that, okay? You can purchase it, as we talked about earlier on in the presentation, but it is pretty expensive. The Part B is the medical insurance, meaning services that you would get while you're not in the hospital. So x-rays, minor surgeries, that type of thing that you might get on an outpatient basis would probably be covered under Medicare Part B. That's your medical insurance. Now, the difference between original Medicare and Medicare Advantage, you've probably heard a lot of commercials about Medicare Advantage plans. We happen to be in the open season for it, coming up very shortly. So the basic difference is that under the original Medicare, you can go to any hospital, doctor, clinic, et cetera, that you choose to go to. Under the Medicare Advantage plans, you are within a network of hospitals, doctors, clinics, etc., that you would have to stay within that network in order for the plan to pay. Those Medicare Advantage plans are very cost effective. The one of the few, if you will, downfalls is that you have to stick within that network. However, here in Louisiana, most of the hospitals, doctors, clinics, all accept most of those Medicare Advantage plans. So some people see no difference in the doctors they're seeing prior to taking a Medicare Advantage plan and after they take a Medicare Advantage plan. They may call their doctor's office and say, hey, do you accept Medicare Advantage plan XYZ? If they do, well, there you are. You still can go to the same doctors, hospitals, and clinics and take part in what is probably a very good cost-effective program that in many cases provides you with not only hospitalization, medical services, but also prescription drug coverage. Some of those plans even include vision, hearing, dental, and a lot more services such as you are provided a small budget where you can purchase online certain over-the-counter medications. So a lot of those plans are really, really good options for most people if they don't have an issue with staying within a certain network. They have much lower out-of-pocket costs, and it, like I said, includes prescriptions, which is a huge part of your healthcare costs. Under the original Medicare plan, you can purchase a Part D, which is a prescription drug plan, but keep in mind, there is a premium for the Part D as there is a premium for your Part B. This year, your Part B is $170.10. So that's one monthly cost you're going to have under original Medicare. The other cost you're going to have is your Medicare Part D premium. Depending upon the plan you choose to take, it'll be more expensive or less expensive, depending upon the copays you want to have, etc. And also, you're probably going to have to take some supplemental insurance along with the cost of Part B and D, because Medicare as a whole only covers 80% of the cost of your hospitalization and your medical services. So that's why you hear about these so-called Medigap policies that will pick up and help pay that 20% or so that the original Medicare does not pay or cover. Once again, that could be a hefty amount if it only covers about 80% of your hospitalization and medical expenses. So keep that in mind. So my advice is if you are in or close to retirement and whatever source or kind of Medicare you have now you're not happy with, contact your local council on aging. They have a department called Senior Health Insurance Information Program. They can sit with you one-on-one, either in person or over the phone. Take a look at the current Medicare benefits that you have and advise you as to whether you would benefit from going with a Medicare Advantage program or switching to another Medicare Advantage program. A lot of information there, but the councils on aging are a great source of information. And once again, I'm mentioning senior health insurance. You don't have to be a senior to get assistance from that department of your councils on aging. They will help you at any age, and whether you you are attempting to go with Medicare at retirement age, or if you're eligible for Medicare through disability. So as far as filing for your Part B, this information that you see here will change a little bit starting next year, but because we're not there yet, I'm gonna simply explain how it works this year. But if you're in a situation where you're gonna be newly eligible for Medicare next year, I would say to go on the Medicare.gov website, and it'll talk about some changes that will occur in this capacity. And certainly if you decide to get some help from the Council on Aging's SHIP department, Senior Health Insurance Information Program, they will most definitely know about these changes. But here's how it works. If you file 1 to 3 months before you reach age 65, you're going to have that red, white, and blue card in your hand the month you reach age 65, and you can go ahead and start using it. If you file the month you reach 65, it's going to push your eligibility back 1 month after the month you turn 65. So as you can see, you're losing out on that benefit eligibility by 1 month. I'm not going to read the rest of these to you, but as you can see, the longer you wait to sign up, the further back your eligibility gets pushed. So just keep in mind, file 3 months prior to your age 65 eligibility. With Social Security disability, you really don't have to worry about this. This all works together under Medicare under disability. But once again, you may be dealing with this situation, and you may have dependents that might be eligible for this enrollment based on being close to retirement age. So I mentioned that Part B, the standard premium this year is $170.10. However, depending upon the tax bracket into which you fall, you may have to pay a little extra on a monthly basis. It tends to go up by, as you can see here, about $68 a month, and then it increases gradually after that, depending upon the tax bracket you fall into when you go to take your Part B premiums. These numbers change slightly each year as well, but it's nothing too drastic. This is pretty much around the area that that Part B premium cost is going to stay. So the Medicare website, Medicare.gov, is a world of information. As you can see along the top there, you can sign up for Medicare. You can also sign up for Medicare on the Social Security website, and I'm going to talk a little bit about that. But you can sign up on the Medicare.gov website. I really like to caution you to make sure you access a website that is the GOV website. There are a lot of independent companies there that operate under a type of Medicare.com website where you get either billed for them helping you with the application. In other words, sometimes you complete the application and it goes directly to them, and they kind of get the processing started, which basically just means they send it to Social Security or Medicare. So be very careful. The only legitimate government websites are a GOV website. But once again, across the top there, just about any information you're interested in for Medicare, you can create an account and go in there and check out all the information that you want for Medicare. You can also call their 1-800 number, and that's listed there for you as well. With Medicare applications, you can file for Medicare only on our website. What I mean by Medicare only is in that situation where you are still working at age 65 and you just want to file for your free hospitalization, you can go either on the Medicare website or on the Social Security website and file for that benefit. Once you are ready to add the Part B or the medical services because you're retiring and you're no longer going to have a group plan, or you don't want to keep your group plan, you can go ahead and complete the form listed there, and you will be set with your Medicare. I mentioned filing on the Social Security website. You access that Medicare only when you go into the retirement icon on our website, and it will basically ask you if you want to file for Medicare only, therefore the term. And it goes through the Social Security internet site directly to your local office, and they process the application for you to file for Medicare only. Later on, when you're ready to file for your cash benefits, then you go ahead and you file through the same process for a full retirement application. So really easy to do. It takes 5 to 10 minutes, and honestly, usually there are no other documents that you need to submit. Once you create an account for yourself, either under the My Social Security or the Medicare GOV website, you have authenticated your identity. And unless we have some type of discrepancy, like in your date of birth or something of that nature, you probably won't even have to provide any documents. There's what we call the electronic signature that we operate under. So a human pair of eyes still reviews your information in your local office, and we contact you if anything else is needed. The processing is pretty quick. You will get a letter in the mail within probably within a week or two, letting you know that they've received your application and everything is underway. And once you actually qualify, you'll get the letter saying you've been approved, and you'll receive your red, white, and blue Medicare card. If you file for Medicare only, the card is going to show Medicare Part A only. If you file for both, it's going to show Medicare Part A and Medicare Part B. So in a situation where you file for Part A only, and then you go back and you add Part B, you'll get a new card showing that you're eligible for both A and B. Okay. I talked about the Medicare.gov website, and this is another way you can file for that benefit. If you are looking for Medicare towards retirement age, if you qualify for Medicare based on disability, we will automatically know that you're eligible for Medicare after the allotted period of time, and you will get a letter asking you if you want to sign up for both A and B. Likewise, if you choose to take your Medicare, your Social Security retirement early, meaning between age 62, as early as age 62, when you reach age 65, because you are already on our benefits rolls, we will send you a letter saying that we've enrolled you in Part A, since it's free, and then it will ask you if you are ready to enroll in Part B. If you're not, because you're still working, no harm done. But we will know in certain cases, mainly if you've been approved for disability or for cash benefits prior to age 65, that we will know when you're due that Medicare, and we will approach you. If you're not on our rolls based upon one of those two routes, at age 65, if you want to file for Medicare, you need to contact us. We will not contact you. Okay. What else? This is what your Medicare card will look like, whether you receive it based on Medicare for disability or for age. And as you can see there, we no longer put the Social Security number on the card. This is for safety reasons. We all know how dangerous it is when your Social Security number is out there floating around. It's the #1 piece of ID theft that those thieves are looking for. So the number you see here, which is a combination of numbers and letters, is the electronic equivalent of your Social Security number. But you will need that number that's on that card when you go to the doctor, hospital, or clinic, because they don't have the means to convert that number into your actual number. Excuse me. And as you can see there at the bottom, in this example, this person is eligible for both Part A and B, and it shows the date that coverage began. So another good aspect of Medicare is the extra help provision. Excuse me. I have a little cough, excuse me. So the extra help provision is help with the cost of your Medicare premiums. So the extra help is something that you can sign up for, and it basically provides you help with premiums and copays involved with your Medicare cost. The income and resource limits, generally speaking, for an individual and a married couple are listed there. Excuse me. And you can, once you sign up for this benefit, you can potentially qualify for either a full or a partial subsidy with the benefits. Some people inquire no cost at all if they qualify. Other people have a slight copay, a slight premium. So for anyone struggling with the cost of Medicare, whether under disability or retirement, we invite you to look into an application for extra help, which can be done on the Social Security website. And this is the Social Security homepage. If you click on the icon for disability, you will be in the realm of disability benefits. You can read up a lot more about disability. You can actually file the application for disability right through that section of our website. There is also a section that says retirement and Medicare. The Medicare portion is not showing here, but it is currently on that website. You can click on Medicare and it will give you information on the types of Medicare. It will tell you all of what I've explained during this presentation and a lot more. So I invite you to visit that portion of the socialsecurity.gov website. So when you go to apply for benefits, whether it's for Medicare or for Social Security disability or retirement, filing online is what we recommend. The reason is that, as I mentioned a moment ago, your application goes directly into the processing queue. If you call and make an appointment, sometimes we can't schedule an appointment for you because our offices are so busy. It might be 2 weeks out, in some cases 3 weeks out. So you're protected back to the date that you made the appointment in case there's any back pay involved for you. But keep in mind that's 2 or 3 weeks that later that your information, that the processing of your application is not started. Whereas if you file online, it gets picked up the next day at your local office and processing basically starts. We let you know if there's anything else that's needed, okay? So definitely a plus. If you can do FaceTime or email, you can handle this application. It's very, very safe and easy. And like I said, you're not alone. It still goes to your local office. I always like to put it in this perspective. When you file online, whether it's for benefits or for Medicare, your information is still looked at and reviewed by human pair of eyes in the local office. You're just choosing to provide the information via our internet or in person. but the processing is still reviewed by a Social Security representative. So I want to talk to you a little bit about the My Social Security account, but here's the number where you can also make an appointment to file for Medicare or for benefits, whether it's disability or retirement. You can call that number and make an appointment. Once again, you may not get an appointment for X number of days, depending upon the area that you're in, etc. And you can make that appointment to file either in person in your local office or by phone, whatever works most for you. But the My Social Security account is something that we have had available to the public for years and years. And if you do not already have a My Social Security account, I really recommend that you look into creating one for yourself. It's pretty similar to what a banking account is as far as banking online, whether you have access to your information 24 hours a day, 7 days a week. You can do a lot through that account. Namely, as you can see here, you can get a duplicate Social Security or Medicare card. You can request it via this My Social Security account. And guess what? It gets to you just as quickly as if you went into an office to do. When you go into an office, you don't get it immediately. It's still a processing and a vetting process before we actually send that card to you. So it'll get to you in a week or two, either way. You can apply for Social Security retirement or spousal benefits. Disability, as I mentioned, the extra help is available for you there too. And another great aspect for those that are not receiving benefits is that it gives you the information that that benefit statement used to provide to you. We don't send those out regularly anymore because it's very, very costly. And because we have determined that providing it through a My Social Security account is a much safer way for you to access that same information. Once you reach age 60, because you're getting closer to the age where you're first eligible to take Social Security, meaning 62, we start sending you a paper statement again if you do not already have a My Social Security account. But please create the account. Another important aspect for you to create this account is you should be checking your earnings record. Your earnings go through many hands before they finally wind up with us, but they directly determine how much you will get paid in disability or in retirement benefits. So if you're missing some earnings, if they were recorded incorrectly, that may affect the amount we can pay you. So with your earnings, your employer is involved. Remember, they provide you with a W-2. If you're self-employed, you have a tax preparer. Either way, you file an income tax return, and then finally, those earnings get to us. When they get to us, they're not always correct. Most of the time they're correct, but we do come across situations where at retirement, we show people their earnings record and they say, oh my goodness, I'm missing a whole year of earnings. And guess what? That was one of the years where I earned the most. That type of situation can really affect your benefit amount. And believe me, you want to cash in on every penny, I venture to say, of the benefit that you're eligible for, whether it's under disability or retirement. So get in there, create your account. It's going to show you a history of your Social Security earnings. Give that a once over, make sure that it looks accurate. It doesn't have to be accurate to the penny, but if there's any glaring omission or inaccuracy, please bring it to our attention. Contact our office. Let us know if you have any documentation regarding the earnings that you're missing, and we'll be glad to help you recover that information and get credit for it. So very important to do. After you do that the first time, you really only have to get in there and look at that account unless you want to. Once a year, towards the end of the year, when last year's earnings have already been posted by IRS, make sure that looks good, and you'll be in good shape for retirement. Okay. So the My Social Security account, you have to be 18 years of age or older to create the account. You have to live within the United States or the Commonwealth or any Commonwealth. And you do have to authenticate your identity, as I mentioned. It's going to ask you a bunch of questions that only you are likely to know, or someone that you share financial information with currently that might know the answers to. So somebody might say, well, you know, I have an ex-spouse. They would probably know some financial information on me. Well, what we recommend is for you to get in there, create that account, and lock it down with your own password and username. And unless you give that out to someone, that person's not likely to be able to get into that account. So very important stuff here. It's not usually the case. That's kind of an extenuating circumstance, because believe me, the authentication process is pretty tight. And we do that to protect people's identity. Some people do not authenticate themselves. In other words, they can't answer the majority of the questions correctly. That's how detailed it might be. And if that's the case, you need to contact your local office. In most cases, you would need to go in with a picture ID, driver's license, for example. And once we identify you, we will give you an activation code where you can go home, put that number in, it will let you into an account, and you can lock it down with your username and password. So you can continue this account whether you're receiving benefits or not yet receiving benefits. So I mentioned what you can do if you're not receiving benefits, a little bit more on that. You can get estimates for your retirement and disability. You could also get estimates for your spouse and for your dependents. Another important aspect that I failed to mention, if you do get benefits, you can even print out a benefit verification letter on your printer. So those benefit verification letters are often needed to get many other services. So that's an excellent, excellent feature of the My Social Security account that you can take advantage of. So little bit more on that, and basically I already mentioned what you can do if you're not able to go in and create a My Social Security account, some of the documentations that you can show to get that activation code. Another wonderful feature of the My Social Security account is that you can go in through that account and do what we call an advanced designation of a representative payee. Those individuals that are already receiving benefits can designate up to 3 individuals that they recommend serve as a representative payee for them should they lose the capacity to manage their own Social Security benefits. So while you have the capacity, Social Security allows you to convey to us who you would trust with your benefits should you no longer be able to transact business for yourself. Keep in mind that at Social Security, we do not acknowledge powers of attorney for transacting Social Security business. That is for financial business related to banking and that type of thing. A representative payee for Social Security purposes is not only someone that is trusted to manage your benefits, but someone who knows of the needs you have as far as daily food, shelter, bills, etc. So it's not just an attorney who has power of attorney. It's not just your child that lives in California that has your power of attorney. We may very well find that a child of yours that you live with is more able or better able to serve as your representative payee because they see what your daily food and care needs are. And that's what we're concerned about with Social Security mainly, is your well-being. So that's something else that you can do within the My Social Security account. We invite you to follow us on social media. Following any one of these types of social media will allow you to see any new Social Security information that comes about. Also, we regularly post information that will help you transact business, make decisions about your Social Security benefits, answers a lot of questions that people walk around with out there that they don't know the answer to. So I'd invite you to visit those. And with that being said, I'll take some questions. Dave Lynn, if you don't mind fielding those for me.
Nope, not a problem. Thank you for doing this for us. I appreciate it. I do have a couple questions in the chat, but for anyone else that has any questions that haven't entered those just yet, go ahead and do that for me now, please. So the first question is, can you draw on a spouse's SSDI if under 65?
You can. To draw on a spouse, the spouse has to be drawing a benefit. And the reason I mention that is because this might be a situation where the spouse is not on benefits, but for retirement, the spouse has to be drawing the benefit. For a disabled person to be able to draw disability on a spouse, there's a lot more involved there. But my best advice, and that's because with disability, unlike retirement, there has to be recent contributions. There has to be enough time paid in within a certain period of time of becoming disabled. So it gets a little bit more complicated, but I would say potentially, yes. Look into that with your local office. For retirement, that is a hard and fast answer of your spouse has to already be drawing a benefit for you to draw on that record.
Thank you very much. So something to keep in mind as we're kind of going through this part of the presentation is everybody's circumstances are different. And so Ms. Marie is amazing and wonderful, but obviously some questions are maybe going to be a little more challenging than others to answer. So just keep that in mind if you don't mind. Okay, so next, if someone needed to speak to someone about a specific Medicare question, can you be contacted directly? Who would you refer them to get good answers about their specific circumstances?
Regarding your specific circumstances, we would be required to pull up your earnings record or the earnings record of your spouse. So I would recommend for that purpose for you to contact your local office, or you can also contact our customer service toll-free number of 1-800-772-1213. And they could do the same thing at that number. It's pull up your earnings record and take a look at how many credits each of you has, when those credits were paid in, etc., and give you a good answer to that. But I also want to let you know that if you create that My Social Security account, that will also tell you if you have enough credits to draw disability or to draw retirement. If you don't have enough, it'll tell you you have earned 36 credits towards Medicare eligibility, or you have earned, 15 credits towards Medicare eligibility. If you're already eligible, it will just say you've earned enough credits for Medicare and or Social Security disability. So that's another easy, if you're just trying to see if you have enough credits, that's another good way to look for that entitlement.
And I suspect this is probably like a family specific situation, if I had to guess. But our local office should definitely be a resource in a case like that. Okay. So the next question is from an adult living with a disability. They work part-time, 20 hours per week, and over the weekend were contacted by the Louisiana Department of Health, informing them that they'll lose Medicaid through the Qualified Medicare Beneficiary Program starting October 1st because they're slightly over the income threshold. And they were trying to figure out whether or not that means they would lose Medicare entirely or just the state's assistance with covering premiums, copays, etc. for doctor's visits. They happen to be a person with a complex health condition and are just trying to figure out whether or not there are other options to supplement with care if that's the case.
Sure. Well, did I hear you say, Dave Lynn, that they're no longer working? Or they're still working?
Part-time, they're part-time 20 hours a week.
But that amount is enough to make them ineligible per the letter that they received, is what I'm understanding.
It sounds that way.
Okay.
It's like bump in pay, I think is the quote.
That question has a lot more to do with Medicaid. So I would advise there's probably some type of phone number on that letter received. Contact that phone number if for any reason you're having difficulty getting through to them or getting the answers you need. I would say contact your parish's council on aging that has that health insurance information program. They know what the qualifications for those specific programs within Medicare and Medicaid, the qualified Medicare and Medicaid eligibility and all of that. But very honestly, I don't deal with the Medicaid aspect, so I wouldn't know how to answer that except for the recommendation I gave you. I'm sorry.
Okay, so we're right at 2. There are 2 other questions I'd like to get to if you have just another couple of minutes.
Absolutely.
So the next question is, can a person, a child over the age of 18 receiving Medicare be placed on a private company's insurance? If so, do they lose Medicare or part of Medicare? If so, what part?
So an 18-year-old, I'm guessing that the parents want to put him or her on their insurance through a company.
Sounds that way, yes, ma'am. Over 18.
Over 18, so that's an adult. I am not sure of the answer to that, and I apologize. These are more geared towards the specifics of Medicare. But what I would like to do, Dave Lynn, if it's possible, I will find the answer to that question. And I don't know if you have the capability of posting it on your website in some form or fashion and sending it out. Once again, generally speaking, if that's a possibility. Because at this time, I am not sure. My concern is I'm sure that you can put them on the insurance, on the company's insurance. What I'm concerned about is the ability to go back on the Medicare. Should, you find that that's something you want to do in the near future. And I'm not sure what the answer to that is. It may even be a matter of what type of insurance it is. It gets a little bit more complicated.
Okay,
But,
yeah, I'm gonna record that question if that's okay, and then maybe you and I can,
Okay.
if you get an answer to that, you and I can correspond directly.
Yeah, I'll get a general answer to that. And since we had that other question about the person who was working and they lost that eligibility, I'll try and find a general answer to that question as well. But I still recommend that individual as well contact that Senior Health Insurance Information Program, which once again helps everyone, not just seniors.
I gotcha. That's a great resource, and I believe that is in your thank you for attending email that you should receive this afternoon as well. One other question, and then I will just let you go. I appreciate your willingness to take this on. The other question is, can you briefly explain, let me get back down there, the process of applying for social SSI for a disabled child before they turn 18. And I will say too, that the webinar that she hosted for us last year, there's a recording of that on our YouTube page. So you might find that a beneficial resource, but if you can explain that maybe in brief for this
Absolutely.
person.
It the process online is best. Go into filing for disability. It will direct you to the SSI program. It's the same as filing for Social Security disability. You provide the medical information online, but because the SSI information is more complicated, remember, it's going to have to do with income and resources and things like that. The difference is that once we receive your desire to file a claim for a child by providing medical information, the local office will contact you and then obtain the income and resource application. Because remember, there's medical and non-medical criteria to meet for these programs. So I always recommend filling out the medical information online because you have your paperwork nearby. You can take your time to complete all that information. It's going to ask you doctors, hospitals, clinics, address, phone numbers. That's information that you will tend to have handy and you can take your time more with if you're sitting and completing that online. But of course, the appointment option is also available. Same way as for any of our benefits, call that 1-800 number and make an appointment to file either in person or by phone. If you call that 1-800 number, I don't have to tell you, our phone lines are very busy. They're open very early in the morning to late evening. I would recommend, the individual call like closer to morning, right when they open, around between 7 and 8, and or later in the evening, maybe between 6 and 7. You're more likely to get in quicker to make that appointment. But if you're not too shy about the internet online filing process, which you shouldn't be, it's really easy to do. It's a matter of just answering some questions, yes or no, and filling in some information and then submitting it. Make sure you submit it. You will even get what we call a re-entry number, so that if you have to step away and you've put in almost all of your information, but you have to step away, you can re-enter and start right where you left off with that number, with that little code. So you need to write it down or copy and print it right at the beginning of the application and have it handy. But it's really not as difficult as most people anticipate. So go ahead and start it online. And if you prefer, go ahead and contact that 1-800 number and make an appointment.
Okay, great. Now there's one other thing I want to ask, and simply because I believe this has changed since you did the last webinar for us. I know at the time they were taking people in person in the physical offices only to like print like a social security card. Has that changed? Can you go into the local office for help now?
You can. We are totally open. We highly recommend appointments because what's happening is that our offices are so full that sometimes you walk in and our schedule for the day is already full. And what we have to do is give you an appointment. So I would highly recommend making an appointment, but especially to file for benefits. But if it's a name change or something to do with a social security card, you can walk into the office for that as well.
Great. Well, I thank you so much for your sacrifice of time for providing this information to us. We talked briefly about Medicaid. I want to use this opportunity to tell you that we have a Medicaid webinar. It's currently untitled just because of the changes that are coming next year in 2023. A Medicaid webinar scheduled for October the 12th at 10 o'clock in the morning. A flyer has been drafted. We're just waiting on an official title for anybody that could benefit from that information. So this Medicare stuff is very important. This has been recorded and should be on our YouTube page in the next week or so. But we appreciate you, Miss Maria. You're really an invaluable resource.
Oh, thank you, David. It's my pleasure.
You don't know how much I appreciate you. I do want to remind our participants to please complete our post-event survey. I did put that in the chat. I'm going to put it in the chat once more. Tell us what you thought. Tell us what other webinars you might be interested in. She did this for us at no cost to you guys, and it's valuable information, and you heard it from someone who has an understanding of it. So on behalf of Families Helping Families of Southwest Louisiana and Miss Maria Alvarez, we want to thank you again for joining us and wish you a good afternoon. Give me just a second, and I'm going to put that evaluation survey link back in the chat. You should also get directed to it when you log off of this webinar with us. Please tell us if you need anything, get in touch with us if we can help you, but otherwise have a great day.